and good afternoon, everyone, wherever you're joining us from. Welcome to the HDC Chat Series, where we bring together experts and thought leaders from all around the world to explore groundbreaking insights at the intersection of healthcare and digital innovation, of course, including AI. My name is Dr. Rachida Parks, and today I have the honor and the privilege to welcome Dr. Tigest Tamrat. She's a research scientist at the World Health Organization. Dr. Tamrat is joining us today in a personal capacity. Her views expressed today are her own and not necessarily those of the WHO. Thank you for accepting to join us today, Dr. Tamrat.
Pleasure, and thank you for the opportunity.
Wonderful. So before we get started, as usual, I do a brief bio of my guests, and I'm going to try to just read the short one, not the long one. Dr. Tamrat is a scientist and in digital health and artificial intelligence. She's internationally recognized in this space with the World Health Organization, where she has spent more than a decade advancing global strategies to strengthen digital health systems. Her work focuses on improving sexual and reproductive health outcomes, supporting countries in digital. Oh, excuse me. See, I'm choking up. It's just the beginning of the interview. I'm so amazed and impressed. And look at that. I'm trying to compose myself to get back to reading your bio. Dr. Tamrat. She's a scientist and an internationally recognized digital health specialist, particularly for sexual and reproductive health with the World Health Organization, where she has spent more than a decade advancing global strategies. Her work focuses on improving sexual and reproductive health outcomes, supporting countries in digital transformation, and promoting responsible and equitable use of AI in global health. Thank you again for joining us, Dr. Tamrat.
Thank you, and it's an honor.
Okay, I think the first question, and not really a first question, but everybody would like to know about your journey. How did you join the WHO? What are you doing? What inspired you to focus on digital health? I know it's a loaded question, but everybody's wondering the who, the what, and the why. So if you can enlighten us, that would be wonderful.
Thank you. And honestly, it's very much a series of fortuitous events that happened. But one of the earlier recognitions was that a lot more people have mobile phones in their hands than they have latrines. And it's not necessarily a public health intervention. It wasn't something that was mandated and said everybody should go and start screening on their phones. But it's something that people are doing naturally. It's a natural way that people are getting information, and so this is kind of what inspired the journey to see how else could it be harnessed to, meaningfully advance health outcomes. And knowing that there was already this wave of technology that was coming into play around 2010 is when I first entered the space of digital health. And at that time, it was still kind of very early, very much focused on mobile phones. There wasn't really WhatsApp or data or internet on people's phones yet. We were still in the era of very basic smartphones. But still, there was a lot that could be done with it. And we were doing systematic reviews on how it could be applied for reproductive and maternal health, to help pregnant women, to help people that were trying to access family planning information or come back for services. And we were seeing some promising trends. And I think that's really what kind of excited us and the community at the time. And following that work, there was new work that was growing within WHO, particularly in the areas of reproductive and maternal health, on trying to harness the incoming powers of digital tools, which is where I first started getting involved.
What a great and interesting journey. I am amazed that you're the second person, and now talking about the second person. We have been introduced a couple of years ago through a common friend. Shout out to Rosemary Moliukela
Yes.
for introducing us. She's wonderful. She works at the WHO as well, and renowned for her digital health work. But today, actually, I'm stuttering because I'm so impressed with what you both do. And I had the honor and the privilege of participating or contributing to a technical brief that you were coordinating about a year ago. And this is my official note to again tell you thank you for allowing me to share my expertise in that space. The WHO technical brief was title Unpacking, and correct me if I'm wrong, this is from memory, Unpacking Artificial Intelligence in Sexual and Reproductive Health and Rights. And you coordinated that last year. What prompted the need to examine AI's role in this critical moment in global health and in this very critical space?
Yeah, thank you. I think, we were at a time at a very critical juncture where there was a lot of excitement about AI. There was a lot of misunderstanding of what it is, not a lot of nuanced discussions. I think, Chat GPT had just come onto scene, and so people were just starting to kind of get used to this concept of AI. I think it was not as in our regular routine as it was a few years back when we started thinking about this. But at the same time, there were a lot of fears. We were hearing about fertility monitoring apps and data being sold and, possible persecution of women, et cetera. And there was, it was kind of all or nothing at the moment. It was all excitement and or all fears. And wherever I was standing, whether it was with people that were really concerned, the discussion was like, okay, this thing is horrible, we're doomed, and it's going to track everyone, and we're going to lose a lot of our rights. And then you go to a lot of tech enthusiasts, and it's like, this is the, invention that we've been waiting for. This is the best thing since whatever, the wheel, etc. And so we felt that we needed a middle ground, and we felt that we also needed a nuanced discussion. There was also a lot of excitement, and I think there is a lot of great potential and even now, activity happening around diagnostic devices, being able to expand access to AI assisted ultrasounds for pregnant women, being able to support quality of care for by health workers to access, immediate information. But we needed to have this nuanced discussion about where is it actually helping to improve care, where is it helping to improve access to information. And the unique thing, I think, especially in sexual and reproductive health, is people actually go to digital tools because there's potential stigma and barriers to accessing care in traditional ways. So the online environment, digital tools are really seen as something that could be a new channel for it, but also brings its own risks. It's always a double-edged sword. So we felt that the technical brief unpacking, what are the opportunities, and not just opportunities in a generic way, but what, using a systematic review, using what's out there in the literature and experts like yourselves to really understand, okay, how is it being used for screening and diagnostics? How is it being used to help for health promotion? How is it being used for health system management? And being able to document those in, through concrete examples. And then at the same time, there are real risks. There are real issues. We need to think about our data governance issues. We need to think about misinformation. We need to think about the potential biases in the data, particularly as this is technology that affects, vulnerable populations, affects women and girls. So we really do need to take these, considerations seriously. And so we kind of put this through the technical brief as almost like a first step to just laying out all the different thoughts that may be going through different ideas, the different people that you talk to. And we're hoping then this can be a platform to then go a little bit more deeply and say, okay, do we recommend this? Or what type of policy actions should be taken, based on these considerations and the evidence that's coming out?
This is so interesting. And I remember there were so many iterations of this
Yes,
technical brief
definitely.
across so many experts. And of course, you were coordinating all those pieces. And I was wondering, oh my goodness, how much work goes into when we read those technical briefs. And we're like, okay, they have all the tools, but those tools you have to really work across the world to put together what may seem a simple technical brief, but it's very thorough, very deep, and involves so many stakeholders. In doing and putting together your initiatives, whether it's technical briefs or actually applied one in this space, what are some of the most pressing challenges that we all together or you must address to achieve equitable outcomes?
Yeah, I mean, first of all, I'll just say that the space is probably moving faster than we can act. And I think this is a common theme, that innovation outpaces regulation, et cetera. And so we're trying, as WHO, we're very much trying to follow evidence and follow, okay, where is their impact? Sometimes you don't get that as quickly as you need to. So you also need to make sure, and that's where we do rely on technical experts like yourselves and the broader community that we were working with to really help guide, okay, what can be done? Because we can't wait until everything is all done and dusted and we have our wonderful RCTs to tell us what to do. So a lot of it is that there's a huge proliferation of different ways that AI systems and tools can be used. In a recent systematic scoping review that we did, we found 12,000 articles, and it could be on anything like assessing whether a fetus is yawning, assessing fetal like gender or sex, um, so many different things that are happening out there. And so I think part of what we need to do is try to figure out where is there a meaningful use, where is there impactful use. And what I'm really excited about now is actually how do we then integrate this into the health system so that it's not just like a nice shiny thing or a cool, experiment or data validation exercise, but actually how do we get this so that health workers are able to use it, trust it, know that it's not going to be hallucinating, know that it's not going to be giving you erroneous information or inaccuracies, whether it's like a screening or diagnostic tool. And actually, how do we integrate it in such a way that it becomes part and parcel of how we deliver care? I think that's the big bottleneck that we're facing now. We have a lot of tools. We have a lot of great things that are out there in the market. There's a lot of private sector partners that are testing and have great innovative ideas. But I think we also don't want to flood countries as WHO, we want to make sure that countries know how to make sense of all the different tools that are being flooded into their system and know which ones to take, what questions to ask, how to make sure that it's working appropriately. If there's some issues that or considerations, context in which it may not work well, then knowing that before it gives you something that can potentially have some repercussions. So I think really the transition to implementation in an integrated, institutionalized way with trust, I think that's where we're at now. I have no doubt that there's a lot of great things out there. We've seen it. There's like, we've seen it in the literature as well. I think another thing that would be really interesting from my perspective at least is how do we also make sure that people that are in vulnerable situations, we don't compound any risks because obviously we know that AI and is powered by data. And that's okay. I mean, that's the truth of it. But how do we want to make sure that if that data is used, that it's not used that's going to backfire on those individuals, that it's not going to be used to say, okay, well, they got this service and therefore, they should be penalized, particularly in SRHR, where it can be potentially contentious, some of the issues in accessing services. So, how do we make sure that that's not done and not also putting the burden on individuals to, consent and opt out and figure out like if they're doing something that's going to get them in trouble? We really don't want to put the onus on people to do that, but rather from a regulatory perspective to say, hey, we can't do these things, with your data. Like you won't be at risk. The same way that like if I was to go to an apartment, I'd like to make sure that someone knows, okay, we can't use this type of lead paint. It shouldn't have to be me to read the label and say, okay, I've chosen this and it's not going to harm me. So I think we need, to make sure that we're not putting too much focus on individuals consenting, individuals knowing, what's happening. There should actually be also some diligence to make sure that that data overall won't be used for like some potential, malicious intent, let's say.
This is really interesting. This was not part of my thought. Of course, as I'm talking to you and talked to you before, this is a new space of looking at digital health globally rather than just within an organization, which has been my focus for the longest time through my research and everything. You talked about data and the risk associated with data at the individual level or even the country level. I'm going to build upon that. How do you, most of the data, as I know of, as we know of, is being collected from Western or developed countries, and a lot of initiatives are built to include everybody. It's you and I, whether you're from Switzerland, the US, or somewhere in South Africa or South America. How do you ensure that AI systems reflect the needs and realities of diverse populations, particularly those in low resource settings?
Yeah, thank you. Thank you for that question. And it's also something that we observed a lot in our research and our reviews that there was a lot of data analysis, machine learning that was done using repositories that are available in high income institutions. And I think, you know, the data infrastructure has enabled for institutions, say in the US and the UK, to have really rich um, repositories that lend themselves to machine learning and AI related analyses that we don't have in, say, lower and middle income context. So I think, you know, we also don't want to conversely, we also don't want to go into this argument around that's happening right now around data colonialism, where people go to low and middle income countries to perfect their models and then, you know, be able to market it or to market it to other contexts, right? So you profit over being able to, you know, train your models on contexts, and then those contexts don't get to actually benefit from it. So I think, you know, the first step, maybe it's easier said than done, is actually building the local capacity to develop the repositories, to develop the data sets. You know, it actually needs to be built up, and not just data in like the quantitative sense, but even the language, the languages to that fuel the large language models. We all know English is probably the most widely spoken language. It's a resource. It's a language that has a lot of resourcing behind it, a lot of documentation around it, so you can really train a lot of models around it. But we need to build that capacity if we want other languages to also be equally reflected, right? To have less hallucinations in them. Same thing for the quantitative data and the research repositories, et cetera. Being able to build those out, but not build those out as well, is just so that they can be extracted and, you know, taken on. So I think we need to make sure, because there is a history of like data being, you know, taken away for other purposes, and that is also something that we should try to avoid, but building that capacity as well, particularly for like screening and diagnostics. I think if we don't have accurate data that represents the populations that will be using or that could benefit from these tools, like an ultrasound, right? If you have been training all your ultrasound on fetuses that are not from that context, you may have things that could be missed potentially. So I think it's important to have that, but done in such a way that's not extractive or exploitive as well, which is kind of the other part of that equation.
I've never heard somebody talk about the capabilities and the capacity of a language into building strong models and having all the documentation based on the language. We assume just because we speak English that everybody's the same boat and have the same access. And here's an anecdote on my end. As you probably know, I speak 5 languages. So wherever I travel, it's seemingly I move around. I even go and barter in the small markets, and it just seems fun till I think I went to a place where I did not speak a word, and it just hit me. It hit me so hard because the assumption is for years I'm traveling, I can get away between those 5 languages. So I got that one. Now it really makes sense when you said those large language models are expecting or built upon English and some other couple languages, but then when you go to other places, it's not personalized to those languages. Um, I'm just amazed, and my brain is trying to work and absorb everything you just said. This is a new point or new information for me, but I'm going to switch to successful scenarios and example. And throughout this our conversation, I really appreciate it. And you did that earlier. If you can provide more examples, illustrative examples for our audience to be able to, I guess, to have a better view. Where have you seen examples of successful digital transformation that improved access or care for women, adolescents, or underserved communities?
Yeah, I mean, I think there are really some great examples that are emerging. One that comes to mind is in India, and there was a case study recently published on it. It's one of the largest telemedicine um, system. I don't even want to call it a system, but program in the world. It caters to over millions of people per day. And you get that level of scale when you're working in India, but it's called E-Sanjivani, and it's a telemedicine program that can either allow health workers to consult with a higher level, like say a specialist, but it could also allow for individuals, patients, clients to also consult with health workers, to get that direct care. And they've worked out some really innovative approaches to really make sure that it works. Some of it is making sure that clients are accompanied by a community health worker when they're having that consultation. So if you're having a consultation in a rural area with somebody, that's with a, say, clinician, physician that's further away, at least, there's a community health worker that can help you dial, that can help understand, how to navigate the digital issues and helping to overcome some of that digital literacy barrier that maybe women may have, women in particular may have due to access issues. So there's been really, and I think they've also tried to make sure there's linkages to the insurance scheme and for financing, et cetera, which is always sometimes the Achilles heels of digital interventions. It's like what happens after the pilot ends and the financing and the funding that runs out. And so being able to kind of link it as a system-wide approach for the payment to be linked with insurance, et cetera. And I think, not to name more like specific examples, but the ones that have really worked well in my experience are areas where they're also accompanied by, mentorship and training for the health workers. There's, there's incentives for you're dealing with the financial barriers that clients may face. So there may be some type of vouchers or, mechanisms to also allow individuals to access the services. So I think it's like kind of thinking of it as a holistic approach. Those are the ones that I, have seen where they're really successful. Another area that just really, really excites me in the digital health space is this concept that we've been working on with partners in the in Norway and in Uganda, and it's informal health. So it's, the fact that for many years now we've been developing digital health initiatives, right, that are kind of, let's say, top down. So you have an idea, it's introduced and you train people how to use it, etc. This is actually looking at how are people already, like health workers, they're using it in informal ways, and sometimes it may not even actually be an approved way. They may be using it to take images of a test result and send it to another health worker to get a second opinion. Now, this is potentially controversial, right? Because that's on someone's phone, on their personal phone. Who says they can just take a photo of it? What happens afterwards? But it's also really interesting because these are kind of like the natural, organic ways that people are using their phones, right? So they don't need training. They don't need to think about sustainability. You don't need to think about, oh, how do I introduce it? It's already there. It was actually thought about from, it's like the ultimate form of user-centered design. The health worker has thought about how to overcome the challenge of getting a second opinion on their own. Whether it's even just having a consultation, an informal telemedicine consultation where they call up somebody that didn't come for an appointment, let's say, and check in if they're okay. Now, this is informal. It's not a prescribed use. It's not like there's somebody set up a system that said, okay, you need to go monitor your patients, da, da, da. But a health worker did that. And it's a human aspect of delivering care. It's using your phone, etc. But then it also has its risks, right? Because should you be calling a patient on your personal phone? And sometimes it's good, sometimes it's not. Um, what are the boundaries there? Are health workers expected to use their own airtime or to use their own devices to be doing these types of follow-up? But, does then do people then just say, okay, well, what if one health worker decides, no, I don't want to follow up on my patients. My job is done. I'm going to go do something else. So then that person doesn't get good quality care. So how do you, ensure that there's equity? So I think this concept of like informal health is super exciting. And I think it's where we're seeing success because the digital systems are scaling themselves, right? People are using the digital systems innately, organically, and they're getting the job done. People are getting care. But there is also, like I mentioned, some of the examples where there is the flip side, where there could be patient confidentiality issues, there could be cost issues, there could be equity issues. So, this is kind of a tangent from the initial question about successful digital health interventions, but I think it's also really exciting to just see that there's answers, solutions out there and really trying to see, okay, how do we then learn from those and try to scale those types of approaches. And I look forward to seeing more of that.
This is really interesting. The more I'm talking to you, the more I'm learning about ways where the ultimate outcome is to take care of patient, is to provide equitable health care, whether to anybody, everybody in any country. And when you were talking about these informal ways, I just kept thinking about the necessity, the quote, necessity is the mother of innovation.
Exactly. Yep.
If you're in a setting where you need to see a doctor, but you don't have the resources to go to another specialist, or and you need second opinion, that one can send it. Not that you and I are promoting this, but that's what we're seeing, and I've seen that in other countries, and we named them offline. Where people are taken care of and they found a way or around to be able to seek care. That to me, that's just and I think to the viewers as well that may be confined to one area to hear about these possibilities, not in a malicious way, but to provide access. There is I know you and Rosemary involved in a lot of these, and hopefully I'm not divulging something I should not, about smart guidelines and digital adaptation kits or the DAKs. How our viewers, health executives, our professionals in the healthcare digital space, from medical doctors again to hospital executives to medical students and AI developers and students. How would you explain what these tools, the smart guidelines and DACs, are, what they are, and why they matter for scalable digital health?
Yeah, thank you for that question. And you said it perfectly well that ultimately, from our perspective maybe putting in like the WHO emphasis here, really quality of care, making sure it's person-centered, making sure that ultimately there is some difference, whether it may not be like health outcomes, mortality level, because we know so many things come into play before that, but just even like service delivery, service access, quality of care, those types of outcomes, really trying to see like, could we move the needle on that using digital as one of the many different, types of strategies that could be available, and digital just being now a very interesting and increasingly like pervasive channel for that. But in terms of the smart guidelines, it really came from the recognition that countries are investing in digital systems such as electronic medical records, but sometimes the content in there may not be standardized. And we had this experience actually prior to launching the Smart Guidelines Initiative, where we were conducting a multi-country research on digitizing paper-based records in Indonesia, Pakistan, and Bangladesh. And we saw that countries were digitizing in different ways, but they had more or less similar content that they were putting in, So, as a very specific example, if you're asking about antenatal care, which was one of the first SMART guidelines, you'll ask questions on maybe their past pregnancy. You may ask if they have any current symptoms. And these types of things are common across everywhere. But each time people were developing a digital system in a country, they were going through like, defining the requirements, trying to figure out what are the set of questions they need to ask, what are the, key triggers for when you want to escalate care. And we saw, well, at WHO, we have these things already, but they're not in a format for digital tools. They're just in a format maybe for clinicians or for policymakers, but they're not in a format that a software developer would do it. So a software developer would probably have to go back, read the guidelines, and say, okay, these are the data things. These are the key things I need to ask. I need to ask about pregnancy complications. These are the common pregnancy complications I should write down. So we thought, why don't we give a package that has this already, like these minimum standards, like these common generic, data elements, these common generic triggers and algorithms that should be in the digital systems, that should be in the electronic medical record, so that there's some level of standardization at least. We're minimizing the amount of time it takes to digitalize, the amount of time people have to gather these requirements. We're just saying, hey, it's out here. You can adapt it to your country context. You can adapt it to, the level of facility that you're working at. But here's a starting point. And initially, we even called it accelerator kits because we thought it would help accelerate the process of digitalization. Um, and these are instead of digital adaptation kits, calling it digital accelerator kits. And so we started doing this, and we realized that, you know, this could work. But then recently, with Rosemary, what we've been also trying to lead is an aspect of implementation research. Because we also realize, like, we need to know if this is an approach that is really working. What are the, common pain points that people have in using it? And it's actually been very helpful for us to then refine the concept of digital adaptation kits. How much content is too much? How do we need to phrase things? We had things like skip logic, but maybe we need to make the skip logic more obvious or ordered in a different way. So those are some of the learnings that we're getting. But ultimately, this is to help standardize quality of care that can be delivered through, as a byproduct of interacting with a digital system, and making sure that we're adhering to the protocols or the recommendations that WHO produces. So if WHO said, you need to take blood pressure, and if you have elevated blood pressure, you need to take this action. We want to make sure that that's known across all the digital systems, right? We don't want missed opportunities for care. And so that's really where I think the spirit of smart guidelines and digital adaptation kits came from. How do we standardize care? How do we ensure adherence to some of the basic things that should be in a digital system? And some digital systems already have these things. So then it's just a matter of just saying, okay, cool. They made sure to include questions about pregnancy complication. They made sure to include stuff around blood pressure, let's say. And sometimes it's an opportunity to upgrade, and say, oh, that was overlooked. Maybe we can take this question from the digital adaptation kit and include it into the digital system. And also, we're learning from countries. We recently had an experience where a country told us, we are working really hard to understand better the role of malaria in pregnancy. And, we had to do all this work to ask about the types of tests that was used to diagnose the malaria, et cetera. And we never went into that level of detail. And so I think we're also learning from countries, based on their epidemiological characteristics, meaning like what diseases are, prevalent, et cetera, to say, okay, maybe we need to make sure that we have more emphasis on this. And maybe we don't need, as much emphasis on this anymore, and kind of learning from doing.
These kits or these smart guidelines, they seem you didn't put them in place, and I was waiting for, okay, we put them in place and we moved on to another aspect or another innovative approach. But you kept talking about this iterative process where you put them in place, but you're learning and then you're applying it to different contexts, different countries, and it keeps building and improving as you're moving along with different processes or different countries. It's really interesting to see the progress that you explain of these smart guidelines and DAKs. You said something earlier that innovation outpace regulation. And all throughout the world, we hear about AI, digital health
Oh, yes.
being either hindered or supported by policies and regulations at your global level. How is that working with, where you're trying to promote digital health within sexual and reproductive health and rights, is what's happening in that space, and make it also a call, if it's possible, within your, of course, your personal voice, what what should be done, or what can we do as um, all of us.
Yeah, thank you. I mean, I think for me, the challenge has also been to make sure we don't throw the baby out with the bathwater, right? Because whenever we go into these discussions, it's like, what do we do? And we also know these technologies are not going anywhere, right? So we can't just be naive to think, okay, well, like it's gonna sort itself out, or that it's going to disappear. So we have to find a way to work through it to the best that we can, right? And we know that we're just one actor. It's a one part of a puzzle. But the way that we've actually been trying to approach it, at least within the portfolio that I lead, is trying to really identify, through rigorous approaches as well, where is it really game changing, and where is it really having an impact, and trying to find ways that there can be policies to support that. So if we find that there's this approach, let's say I don't want to name something, but like let's say there's this one approach of using AI that is really supporting quality of care. We want to make sure, A, that we've done some basic research and evidence synthesis around it, right? Because we also don't want to say something and then someone says, actually, there's been like so many harms from it and it doesn't even really work. It's just like something that worked for like a small sample size somewhere in a really nice place, but it's not really scaling, etc., or it has all these feasibility issues. Then we also need to take that into account. So we need to see where are things working, and there's a lot of exciting things. I mean, I actually think there's so much positive impact that we can see, especially with AI, and helping to expand some of the areas that I'm seeing now is like expanding access to fertility care, in fertility, in the maternal health space, in the reproductive health space as well with fertility monitoring. We know people are using these tools naturally, etc. So I think it's really being able to harness, okay, this is great. This is how it's working well. These are the things that you need to watch out for. And being able to articulate what are those operational considerations. And we learn that through, you know, implementers, experts, everyone that's kind of in it. So we as WHO are conveners. We're brokers of information, etc. So we're not the ones that are going to go out there and, you know, assess every tool. We need people to be assessing, we need people to be doing the due diligence, and then we help synthesize, convene, coordinate, and put that critical lens to it. So I think on one side, it's really trying to make sure that where there's promising approaches, that we're able to identify them, we're able to understand them, we're able to demonstrate how they work, how they may not work, where they may not work. And that's okay as long as we're able to articulate that. If we're able to say this works well, but it doesn't work in populations where there's high prevalence of XYZ, that's okay as well. We don't need everything to work well everywhere, but we need to know those things. So I think a lot of it is like doing that, detective work, evidence work, making sure we're doing it in a rigorous way. And I think that's where a lot of our partners, a lot of the people that advise WHO really come in, and we are very selective about how people advise us, making sure there's not that we're aware if there's even conflicts of interest, etc. At the same time, um, we need to be watchful to make sure. We've seen some unfortunate issues, even I think that article with the chat GPT and the suicide that happened. We need to be watchful because there are cases where things can go wrong, right? And we don't want to just continue saying, we're going to break eggs to make omelets and just see how it goes. We also need to be kind of vigilant about these issues. So understanding, really from the data protection perspective, are there safeguards that we could be putting in now? What types of measures should we be putting in at a regulatory level to make sure that it doesn't have any negative consequences? Obviously, we're not going to know all the answers now. And that's why the innovation kind of will always outpace, because it's only once we start seeing how things are playing out that we can then say, okay, this is an issue and let's do some, let's make sure that we put in some measures, we may be able to preempt some issues too. We may be able to say, well, these are, populations that are traditionally marginalized, so we need to be extra careful. And being able to put out those types of considerations, I think that's really how we're seeing it, is like, let's really make sure that we know where we can do great things. Let's not throw that out with the baby, with the bathwater, but let's also make be vigilant, right? And I think there was a really great article that was written by my colleagues in the department that's overseeing the overall digital health and innovation work at WHO across different teams. And they had an article that was something around like AI, like optimism with safeguards, and that's kind of how I also see it. I do think we're in for potential improvements in how people can access care and how health workers can deliver care. We also don't want this to be a substitute to, hire health workers and pay them properly and train them. That's not what we want. But we do think, I mean, I do think that there is potential to really be able to improve quality of care and fill some of the bottlenecks that, address some of the bottlenecks that we've had in being able to provide, timely care, et cetera.
Dr. Tamrat, I have another question, especially in this global space, and since we're talking about wishes, but also about seriously including other voices. So, whose voices need to be more intentionally included in global conversations about health AI?
Thank you. So, I think definitely there's a lot of amazing researchers from, even institutions across the world. The ones that come to mind are a few that are based in Africa that are, leading the actual research, building those repositories and that knowledge that we talked about a little bit earlier. And I'd be happy to share some of those names, offline. But I think there's definitely a lot of from the research angle, people that are moving the field and generating the evidence that we as WHO need to base our decisions. One other person that I think, maybe this is my WHO bias, but I do think the Dr. Alan Lebrique who's from my uh, other department, which is the Department of Digital Health and Innovation, leading that work, I think would be an excellent contribution to this discussion, as he oversees, his department at least oversees a lot of the cross-cutting foundational elements that need to happen for digital transformation, digital health transformation generally, and I think would be a great addition to this.
Thank you. Absolutely. Um, and a last thought or a last question. What final insights would you like to share with our audience, which is clinicians, policymaker, innovators that are striving towards AI ready, equitable health systems?
Yeah, and I will even put myself in this space, but I think increasingly, when there's the disciplines are coming together very, very closely. When I first was in this space of even M Health, back over 15 years ago now, when I first entered this space, it was very like different, and you had the software devs right in one corner, and then you had the health program people. And I remember even when I joined WHO, there were a lot of health people that said, "Oh, no, 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 I don't understand this technology thing," or, digital is something that is just kind of like a futuristic thing. And this was like maybe over a decade back. And I think COVID was one of the things that helped change. And then now with ChatGPT and AI and, digital just being more accessible and part of our everyday, it's in our social media, it's in our WhatsApp. We've actually had to use it to make appointments with doctors. We used it to get messages about vaccinations, etc. And I think the disciplines are actually blurring, which is exciting, right? So we don't actually we're more and more becoming multidisciplinary as individuals. And I think this is a really great shift that I've seen, in the past, say, 2 decades, where people are coming together, and you don't really have clinicians that don't know anything about digital health like they do. And you also don't have people working in the digital sector. I mean, even if you take the big tech companies like Google, right? There's Google Health. Even if you think about TikTok, TikTok is aware about health issues, right? Just because there's so much information about health that's floating around social media. So I think we're coming to a place where everything is kind of coming together. We still have our unique contributions and expertise. Like I don't expect a software developer to start doing surgery or diagnosing someone, but I do think now software developers are very, they'll tell you like the TB regimens because they know it now because they're having to code so much about these things. Yeah, so I think more and more disciplines are coming together, and it's not as separate as we used to think. And I think that's just part of how the world is moving as well.
Thank you so much for your time and thank you for a rich and very engaging conversation. I hope to meet you in person someday and
Yes,
definitely engage with
likewise.
other experts within the World Health Organization.
Thank you so much for the opportunity.
Disclaimer: the views and opinions expressed in this podcast are those of the presenter and do not necessarily reflect the views or positions of the organization or entity represented by the presenter.